It says, good morning, Prof. What's your plans towards prostate cancer, which is becoming more common, maybe due to advancement in medical research? That's from Mohammed Kabir Sheo. Then this one is, good morning. I really like this cancer program. Please, this question go for Aisha. How can we prevent cancer? But I'm scared of cancer. Frank, this is Frank from Port Harcourt. Now, Prof, I mean, just the question, just a follow-up to that question. A regular, health check is important for us to be able to detect, early, issue of this cancer. But how often would you advise that, people should go for this regular check?
So, Nigeria has developed the National Cancer Control Plan, which is the document that is required as far as cancer care and cancer prevention and cancer services are concerned for every nation. Part of the document is about screening, that is prevention, of cancers. People talk about prostate cancer, what are you doing about it, what you are not doing about it. The most important thing that people need to understand is that you can detect prostate cancer by just a simple blood test, which is the prostate specific antigen, or PSA, as the case may be. Every person is at this point enjoyed to go and do a blood test, a PSA, from the age of 40. That may save his life, because if it is detected early, it can be cured. And knowing the fact that 1 out of 4 black people anywhere in the world will develop prostate cancer in their life journey. So if you are able to do PSA, blood test, simple blood test, from the age of 40, you will be able to pick prostate cancer very early and cure it effectively. But the problem we have is that that document, the NCCP, the National Cancer Control Plan, has been costed, but it has not been, it does not have the financial backing to be executed. So there is no compulsory PSA screening or screening for prostate cancer. There is no compulsory screening for breast cancer or for cervical cancer. As a country, I think that should be institutionalized and make it compulsory, because by the time you have developed the disease, then it's too little too late. Say, for instance, not many people are still interested in doing the HPV testing, and we are not talking of even the screening. Even the prevention, the HPV vaccine, not many people are really interested in it. Even though Nigeria has done fantastically well, Nigeria has been able to, in the last 2 years, to immunize almost 50 million children, which is really, really a wonderful thing. But sustainability is very crucial.
When you say make it compulsory, how would you advise government to make it compulsory? Are you collaborating with policymakers in this regard?
Yes. So you see, if it is costed and it is mandatory that everyone should have those investigations, because
it's the problem of affordability now.
So that is why it is costed. If it is costed, then there is funding for it. Like this, our study, not many people. The cost of one drug of these tests that we are doing is 9.5 million for one cycle for one individual. So BMS has provided drug worth 10 billion naira. Okay, so everything is free and people want to key into it. But if government is unable to cost and get support, then that mandatory thing becomes almost impossible. The vaccination that we are doing, it's basically free, right? And that is why government can make it, compulsory for every child in this country. You are preventing, because you see, cervical cancer, for example, can be prevented. So you don't even develop the disease. Unlike colorectal cancer, you can screen. Unlike breast cancer, you can screen and detect it early. But cervical cancer can be prevented, so you don't even develop it at all in the first place.
The problem, especially amongst those in the rural area, is accessibility. It may be affordable, but what about the accessibility?
I know that government is also working very hard to strengthen the primary health care. And the primary health care should be the first focal point of screening as well as preventing cancers in the country. if we have been, I think the Honorable Coordinating Minister has been very passionate about that, to make sure that they have strengthened all the, I think they have literally republished all the primary health cares in this country. And that is where people should be going to. So there must be awareness and education, because it is one thing to have them, it is another thing for the people to really key in and be able to access those type of services.
Many thanks, both.